Hi guys, my name is Sarah and I'm an esthetician here at Renaissance Salon and Spa, and today we're going to be doing a little demo of our dermaplaning service. So we've already started by prepping the skin. We've cleansed it with one of our Lemieux cleansers, and then I've got a prep solution on the skin that just ensures that any products are off of the skin, oils, makeup, things like that, because you want a really dry surface when you dermaplane. So some of the benefits of dermaplaning are a reduced appearance of fine lines and wrinkles, of course the exfoliation benefit. So what it does is it removes an entire layer of the dead skin from the face, all while taking the peach fuzz off, or those little baby hairs off as well. So it really preps the skin for any kind of treatment we want to do after, any kind of peel, things like that, so that the skin can really absorb the benefits of the treatment. So like I said, we've already prepped her skin, so we're gonna get started. So I've got my scalpel here and my blade. We hold it at a 45-degree angle and work across the face. I start with the forehead and move my way down. The whole time I'm gonna be checking in with Leslie here, our model, to see how she's feeling, if it's comfortable, things like that. Most people compare it to like an itch that they didn't know they needed scratched, so it's pretty comfortable. So let me just move my light, and then we'll get started. So I am actually certified through Dermaplane Pro. So I'm a Dermaplane Pro professional. I did my training in Tulsa, Oklahoma at St. Francis Medical Center. And so I use exclusively their blades, their products, things like that. So you can feel really good about the service you're receiving. I don't know if you can tell from that video, but you can already see a lot of the dead skin that's being removed from our model's face. She's got very, very dry skin, so this is going to be a really great treatment for her. Leslie, how's that feeling?
Feels good.
Okay. Pressure feeling okay?
Yes, ma'am.
Okay. So what kind of skincare are you using at home?
Lemieux. I'm not really quite sure what the cleanser is.
Okay.
I can't remember.
So keep in mind, ladies, if you are interested in this treatment, one of the contraindications for receiving it is use of a retinol or a retin A. So if you're using any of those type of products, we just ask that you discontinue them for at least a week before you book your dermaplaning treatment. It just can really thin the skin and kind of make you more susceptible for nicks and cuts. So we just ask that you would just discontinue that, and then you're welcome to come in. This is the results from our first little passes on the forehead. So this is a combination of dead skin and facial hair that came off, so pretty impressive. And as you can see, she's not red at all. There's no bleeding or anything scary. It looks really good. So we're just gonna keep on moving.
It kind of tickles a little bit.
It does kind of have a little tickle. That's just more of the facial hair that's coming off. So Leslie, I'm gonna have you turn like that. And then we'll start moving down the contours of the face. So this is a great alternative for people that maybe can't get waxed on the face, or wanting some of that facial hair gone, especially along the lip line, but have some issues with waxing as far as like sensitive skin, anything like that. This is a really great alternative for that. So and like I said, this is another great way to prep the skin for a peel. So my recommendation with a dermaplaning treatment is our OMG facial, because it follows with a really light peel. So that's just going to leave the skin really nice and glowing, really, really beautiful. So if I had to pick a treatment combo, that would be it. I don't know if you can kind of see what's coming off of her face right now, but we're getting some good stuff. Still feeling okay?
Yes.
Okay. And it's important to be checking in with your client the whole time. Like I said, the blades I'm using are Dermaplane Pro, so they're great quality blades. But if things ever start to get dull, it can become just a little bit uncomfortable. So if you're going to receive this service, just check into your service provider's education. That's one of my biggest things I would recommend. And see, I'm just sort of pulling the skin. I'm making a little C with my fingers and sort of pulling it taut and just moving in small, gentle sections. And my thumb is blocking her eye, so there's no risk there. Skin is feeling really good, nice and smooth, so I'll have her turn back, and then we're gonna work down this side of the face, and then I'll do her chin and her nose last. Another important thing to note about receiving this treatment is if you have really severe acne, so any sort of raised breakouts, things like that, you would not be a great candidate just because it would damage the integrity of the skin if you were to go over like a raised pimple, anything like that, as well as like moles on the face. Moles we can work around a little more. You just would dermaplane around the area, but if you have really inflamed cystic type acne, you would not be a great candidate for this. So just keep that in mind. And I just took my left glove off just to kind of get a better feel for her skin to make sure that we're getting everything and have more of a true feel of the results. So that's why that's off now. What about our videographer? Do you have any questions about this treatment? Anything you want to ask me?
Afterwards, is it a good system for letting that makeup go on your skin a little bit easier? So if you were to have any upcoming events that you want nice, clean makeup, how soon before that event would you recommend doing a dermaplaning for that smooth makeup look?
So I would recommend doing it about a week before. Sometimes after dermaplaning you can experience a little bit of a breakout just because it is such a deep exfoliation, so I definitely wouldn't recommend it like the day before a big event or anything like that. So I would give yourself a week because it is a really excellent prep for getting that makeup to go on really beautiful and smooth, but I would just give it about a week. So, and again, my thumb is blocking her eye, so there's no risk. And then we're just gonna move and do her lip here. So pulling it really taut and tight and working across like this. I would say I've had dermaplaning done myself. I would say the lip is probably the most uncomfortable area. It's just a little more sensitive, so. And she is pinking up on her cheeks just a little bit. That's really normal. That redness will go away after we continue with the rest of her facial treatment. But again, you just have to remember that it's a very deep form of exfoliation. So you are going to be a little bit pink immediately after, but that will go away. This is also great to prep the skin for any kind of extracting I'd need to do. So I can see that she's got just a few like blackheads, clogged pores, things like that. So this is essentially just removing anything that's blocking that top layer that's kind of not allowing me to extract it as easily. So it's a great prep for that. So for the jawline, I like to stand up because I feel like I get a better angle, and then I just move still at my 45-degree angle.
If someone was to make dermaplaning a regular facial treatment, how often would you recommend them coming in?
I recommend this treatment every 6 weeks. About 6 weeks is when you're going to start to kind of feel the regrowth of the facial hair. And one of the myths that's kind of out there with dermaplaning right now is that the facial hair is going to grow back darker and thicker. That's actually not the case at all. Since we're moving at that 45-degree angle, we're not giving that hair a blunt removal, a blunt cut. So it's going to come back nice and smooth, just like it was before. And I actually have a client, she's been in now 3 times for dermaplaning. She's got really dark facial hair, and even the second time she came in, we both agreed that it was coming in a lot less dense along the face. So it is a treatment that I would recommend if facial hair is something you're struggling with. For most people, the removal of that is just kind of an added benefit, but if that's sort of something you're really concerned about or self-conscious about, this is a really great treatment for that. So yeah, I would say just about every 6 weeks, that's when you're going to start to notice things kind of feeling rough and bumpy again. So, and this is definitely something you can do too much, so I would not recommend this like as an every week treatment. It's just going to be a little bit much for the skin. So I don't know if you can zoom in and see this dead skin that's coming off of her nose, but
That made me laugh.
sorry.
I'm sorry for.
So the skin is feeling really good. Like I said, she's pinking up along her cheeks, so I don't want to do any more there that's going to irritate anything. If anything, I would probably move a little bit farther down her neck here and just continue to get some of that peach fuzz. But just that quick and easy, we are done with our main bulk of the dermaplaning treatment. So absolutely call the spa if you have any questions. Our front desk receptionist Alicia is happy to answer them for you, or you can ask for me. Again, my name is Sarah Ann, and I'm an esthetician here at Renaissance. So yeah, just give us a call if you have any questions. I hope you enjoyed.